Hello, my name is Sarah Skimveld and I'm a student physical therapist at Trine University. Today in this video, we'll be reviewing what you need to know regarding your total knee replacement. In this video, we'll be discussing general rehab goals, safety and education, and a review of your prescribed exercises. First, we will be discussing our general rehab goals. The first general goal is to achieve our full range of motion of the knee. So this is about 120 degrees of knee bending or knee flexion, and we would like to achieve about 1 to 2 degrees past zero of knee straightening. These degrees of range of motion are important because it will allow for full functional walking, getting in and out of a car, and other daily activities that you'd like to perform. The second general goal is to ensure you have enough strength built back up into the affected leg to ensure you're able to complete all of your daily activities along with your hobbies. This should be measured throughout your rehab period. The first piece of education I like to give patients is not to scare you, but to let you know that it's totally normal for the knee replacement to be painful, okay? But it's going to be all right. Like I said, it's not meant to scare you, but it's just to let you know what to expect for the few weeks following your recovery and as your therapy progresses. The second piece of education is about infection avoidance and incision care management. So, when you are tending to your incision, your bandages, your wraps, whatever it may be, just be aware for signs and symptoms of infection. So this could be redness around the wound. This could be an odor, significant drainage coming outside of the bandage itself. If you start experiencing fevers, chills, anything like that, it could be a sign that the incision is beginning to become infected, and we really need to get on the phone with the doctor's office and go be seen to get that taken care of as soon as possible. Next is understanding the signs and symptoms of potential deep vein thromboses, or DVTs, or otherwise known as blood clots in the lower legs. In order to lower that risk of obtaining those blood clots, make sure that you're doing your exercise as prescribed and at least once an hour getting up and walking around your house for a few minutes to keep the blood circulating efficiently. So the last formal piece of education is about your icing regimen that you're going to use. So those few days after surgery, you're going to want to be icing your knee very frequently. So we like to say a max amount of 20 minutes at one time, and then you're going to want to do that after you exercise, before you go to bed, and then anytime your leg's feeling sore. Now we will discuss proper positioning. This is known as the tiered pillow resting position. First, we take one pillow and place it mid to 3/4 of the way up the thigh in a vertical position instead of a horizontal position. The next pillow begins just above the crease of the knee, still in a vertical position, and the last pillow, if needed, will also be in a vertical position and should begin just below the crease of the knee. Having the pillows tiered keeps the knee straight and elevated at the same time. We want to avoid resting with something directly underneath the knee so the muscles don't become tight and stuck in a bent position. So here are some things you'll want to avoid. Try not to roll up a pillow and rest with your knee directly on top of it. This promotes the bent knee position, which is what we really want to avoid. We also want to avoid just throwing a pillow under the knee horizontally and resting because it also promotes a bent position. So this brings us to the first exercise. These are called ankle pumps and are primarily used to maintain good blood flow throughout the legs. Now you can't do too many of these, so try to do them every commercial break, before or after you sit down, as well as when you're doing your exercise program. As you can see, the ankles just move up and down, and that's one repetition. The next exercise is fanny squeezes. This is another exercise that is really good for keeping that blood flowing in the legs. So what you'll do is you'll tighten up your muscles in your bottom, hold it for about 10 seconds, and then you'll relax for about 10 seconds. So next we have our calf stretch. For this exercise, you will need something like a belt or a towel that you can use to wrap around your foot. So you're going to place the belt around the ball of your foot, hold each end of the belt with both hands, and then gently and slowly pull your toes towards your nose. Hold this stretch for about 20 seconds, let off, and repeat. You should feel a gentle pull in the back of the lower leg during this exercise. Our next exercise is heel slides. For this exercise, you will also need to use that belt or towel that you just used for your calf stretch. So what you'll do is wrap around the towel around the arch of the foot. You'll cross the two ends over to form an X shape. Then slowly start pulling your heel towards your bottom, letting your knee bend as much as you can tolerate. This exercise can be a bit painful, but you will not hurt your knee by doing this exercise in a slow and controlled manner. For specific hold and relax times, go ahead and refer to your specific home exercise program. The next exercise is heel prop. For this, you will need a pillow that you're able to roll up, or a rolled up bath towel, or a stack of pillows, something that is going to be able to elevate your leg a little bit. You'll position the pillow or towel underneath your heel and keep the knee as straight as you can. There should be a little bit of space or a gap between your knee and the surface that you're sitting on. This exercise has a tendency to be a bit painful, so try your best to relax the leg muscles the best you can. If it becomes too painful to hold the position, stop. Refer to your home exercise program for your specific hold and relax times in this position. The next exercise is our heel raises. For this exercise, you will need to place a rolled up pillow or a rolled up towel, something like that, directly under your knee so it is in a bent position. From there, push your knee down into the pillow or towel, focusing on squeezing those thigh muscles while simultaneously lifting the heel from the surface until the leg is straight. Hold the heel up for about 3 seconds and then slowly lower the heel back down. Refer to your home exercise program for specific numbers of sets, reps, and hold times. The next exercise is our straight leg raise. For this exercise, you will have a rolled up pillow or towel under your knee. From there, lay down on your back and bend your other knee up. Next, you will raise up your heel like we just saw with our heel raise exercise and hold that position for about 3 seconds. Then you'll raise the whole leg, keeping the knee straight until it is about even with the opposite knee. Hold that position for about 3 seconds and slowly lower down. Refer to your specific home exercise program for sets, reps, and hold times. Our last exercise is the hamstring stretch. To begin, scoot forward to the edge of your chair and straighten out your surgical leg in front of you. From there, pull your toes towards your nose and be sure to sit up nice and tall. Lean forward, keeping your back straight until you feel a firm stretch in the back of your leg. Refer to your specific home exercise programs for the number of sets, reps, and hold times.